Yeah, so Dr. Brind, if I were to tell you that Governor Cuomo is planning to introduce the Reproductive Health Act, which for all intents and purposes makes abortion and contraception fundamental human rights, having done all the research and studying into these types of chemicals, what would you say to that?
Well, these are not benign. I mean, would you want to give these things to athletes? For example, contraceptives are just a female version of the same kind of synthetic carcinogenic, non-biodegradable steroids that you find people going to jail for or losing their medals for. They're very serious drugs, and yet the idea is somehow that's contraception, as if that's perfectly safe for girls or for women. It isn't. It does cause breast cancer, among other things. Oral contraceptives are listed as Class 1 carcinogens by the World Health Organization, with good reason. When it was discovered by most women that combination hormone replacement therapy for postmenopausal women causes breast cancer, the number of prescriptions written for those medicines went down by 70%, and the incidence of breast cancer among postmenopausal women, in fact amongst women overall, since that's the largest group that gets breast cancer, actually went down in the last decade, which is the first time it had gone down at all since anyone started keeping records. So these are, and the oral contraceptives are actually the same type of medications, but they're even worse because the ones for postmenopausal women are a lower dose and they tend to be a more natural formulation, a natural animal product, whereas the ethinyl estradiol and the progestin components of oral contraceptive pills are entirely synthetic. By necessity, they are designed to be resistant to biological degradation by the liver. Otherwise, if you took it as a pill, it would break down and it wouldn't work. And yet, the literature continuously tries to cover it up and put out phony study after phony study saying that they are somehow benign and that they don't increase the risk of cancer, when in fact, if you look at the data very clearly, they very clearly do. And to give these very serious drugs, to make them legal in the first place, with or without a prescription, but then to say that a school nurse should be able to give them out to a 12-year-old middle school girl when she couldn't even give out an aspirin or a Tylenol for a headache, but she can give out these very, very serious carcinogenic pills. This is insane. This is irresponsible. It should be criminal. That's what should be criminalized, if anything needs to be criminalized. That's horrible. It already is for men to take that kind of steroid drug to enhance their performance on the playing field, but somehow we can give it to girls to enhance their performance in the bedroom, I suppose. Not a good idea.
Thank you very much.